Assalamualaikum and a very good day to my dear lecturer and fellow friends. Today our group will be presenting about detection of SARS-CoV-2 through serological antibody test ELISA. This is the list of our group members. The topics of our presentation today are principles, methods involved, advantages and limitations. So today I will be presenting about principles. So what is ELISA? An ELISA test or EIA measures and identifies antibodies in your blood. You can use this test to find out if you have antibodies to particular infectious diseases. Your body generates antibodies, which are proteins, in reaction to dangerous chemicals known as antigens. An ELISA test may be used to diagnose HIV, which causes AIDS, Lyme disease, and pernicious anemia. Next, what is the COVID-19 ELISA test? The COVID-19 ELISA IgG antibody test is made up of two serial enzyme-linked immunosorbent assays for the qualitative detection of human IgG antibodies in serum and plasma specimens collected from individuals suspected by the healthcare provider of prior infection with the virus that causes COVID-19. Next is the test principle. The assay uses recombinant spike protein in a two-step sandwich format. In the first reaction step, patient samples are incubated in the antigen-coated microvells. If present, specific antibodies will bind to the antigens. Next, I will pass the presentation to my friends.
Hi, I'm Karthika Tinakaran and I would like to explain about the process that used to detect the SARS-CoV-2 by using ELISA test. Now in this slide, I would like to explain furthermore about the methods. First of all, the blood sample is collected from the SARS-CoV-2 patient. For the second step, after the clotting of blood occur, the yellowish fluid is separate from the blood sample after centrifugation process. For the next step, the media binding microplates were coated with 150 nanogram of SARS-CoV-2 and protein per well, followed by incubation process where antibody against SARS-CoV-2 present means it will bind to the viral protein immobilized on the plate. Now the next step is washing. The wells were washed 3 times with the PBS 300 microliter using Flex ELISA washer. The next step is the addition of detection antibody. Enzyme linked secondary antibody is added. Next step is incubation and washing. Incubate again the microplates to allow the secondary antibody bind to capture any antibodies and then wash to remove the unbound secondary antibody. After that, the substrate is added to the wells that can react with enzyme linked secondary antibody because color change will occur if antibody against SARS-CoV-2 is present. For the optimal density measurement, each well is measured using the spectrophotometer as the OD will indicate the presence and concentration of SARS-CoV-2 antibodies present in the patient sample. Finally, the OD levels is compared with positive and negative result. Conclusion, the higher OD level indicate the presence of SARS-CoV-2 antibodies present in the patient samples. Now I would like to explain about the interpretation of result. For picture A shows the range of SARS-CoV-2 and peak coating concentration from 6.25 nanogram to 200 nanogram. For picture B, for positive result is from 1 to 100 to 1 to 3200 ratio. Negative control and also blank is included in picture B. Picture C and D shows the effect of antigen coating and sample dilution on signal reading. We can conclude that 1 to 100 ratio is able to fight against the SARS-CoV-2 is identified by using the ELISA test.
There are few advantages of using the ELISA the detection of SARS-CoV through the serological antibody, it is ELISA. Firstly, it is free from radioactive substances and hazards because it uses enzymes as labels instead of using radioactive isotopes. It is used to detect the presence of specific antibody or antigen in a sample. Next, it is highly sensitive and specific. It is by using the specific viral antigen as coating agent on the plate, the test can distinguish the antibody's response to COVID-19 from other infection or reactivity. Next, the assay's reproducibility is high, mean it can be performed in a large scale screening in high number of tests. Last but not least, it is quick and easy to perform. As they are not as rapid as some other diagnostic method, it requires a specific time to perform. ELISA tests also can be varied, depends on the equipment provided.
There are some limitations in ELISA techniques such as labor intensive and expensive to prepare antibody. It because it has sophisticated technique and expensive culture media are required to use. Second is a high possibility of false positive or negative result. Is due to insufficient blocking of immobilized antigen result in the first result. Next is it has limit to antibody instability because refrigerated transport and storage are required as an antibody is a protein. Lastly is a complex assay development workflow. This includes several time intensive wash step during this technique being used. In conclusion, ELISA is an effective method that can be used for diagnostic purpose in addition to general biomedical research.